Pfizer is now the first fully approved COVID-19 vaccine by the FDA, and many people are talking about the approval and about booster shots. Here to answer some of those questions is our 9 health expert, Dr. Payal Kohli. Good morning.
Good morning, Gary.
So we were just talking about boosters. I'm learning a whole lot here, but let's start with the FDA approval. What exactly does that mean?
This means a lot. This is a huge milestone in our fight against COVID-19. So firstly, the people that were holding out, which was about 30% of people that were saying until we get full FDA approval, we're not comfortable. Hopefully those people will come around. Second, employers can now mandate this. They can require their employees to get it, which I think is going to be a huge percentage of the population getting it. And third, the company can now start advertising and marketing about life with the vaccine, which I think will also reach a certain percentage of the population.
They even have a name for it, I understand.
I know.
I don't know what it is. I can't remember, but it's
Comirnaty, or it's hard to pronounce.
Yeah, it's always these weird names. Anyway, okay, and then there's the booster shot too, and so a lot of people have been talking about that. Should we just go out and get a booster if we're vaccinated?
Not quite yet. So if you're
Okay.
immunocompromised, absolutely go and get that booster because you need it to catch up to everybody else. But if you're immunocompetent, meaning you have a normal immune system, you want to be a little careful about jumping the gun, so to speak, because the FDA and the Committee on Immunization Practices, which is the CDC committee, has not yet looked at the safety data. So they have not yet given EUA, emergency use authorization, to the booster. So let's hold tight for just a few more weeks because that should hopefully be coming soon.
What is I think it was the governor or somebody mentioned 8 months after you get vaccinated, you could go get your booster, but that sounds like that's not for sure.
Well, there's something magical about 8 months. So a lot of people say, well, what if I'm at 6 months or what if I'm at 9 months? And actually the studies that they base the decision on are really done at 6 months instead. So if you're at 6 months, it should be fine. If you wait several years to get a booster, that's when it starts to become ineffective. But if it's 9 months or 10 months, we think it'll still be effective.
Now, is the booster shot, as long as it's the same brand, is it the same shot that we got the first time?
It is, and that's what's interesting. I had kind of personally wished that they would have kind of done a software update, so to speak, and put the Delta variant in there. Now, the Pfizer CEO told us just yesterday that the company is working on a booster with the variant, but currently the boosters are the same, and we're seeing that they work pretty well to boost those antibodies.
You know, we've been lamenting for months about the number of people that have decided not to get vaccinated for one reason or another. Do you think it's getting better? Do you think they're getting the message?
I think it's getting better, and I think yesterday was a huge part of that. It'll reassure a lot of people now that this is fully FDA approved. It'll reassure people that they've looked at over 40,000 patients of data when making this decision. And I think that hopefully that'll help us, like we talk about next year, getting our lives back to normal.
I hope so. Dr. Kohli, is always good to see you.
Good
Thank
to
you
see
much.
you too. Thank
All
you,
right.
Gary.